Hi, thanks for watching our video today. This is about the Infrex unit, which is a technological breakthrough in what we've had over the past half a century. The reason it's a technological breakthrough is historically the form of therapy that is most used in the world for the relief of chronic pain is called interferential. One of the reasons interferential has worked so well, it's always worked in the clinic, the hospital setting, where the patient would have to come in, take a 20 or 30-minute treatment, and then go away. If their pain comes back, they have to revisit the hospital or clinic for another treatment. Not only is that expensive, but it also causes problems for the patient going back and forth, especially if they work, and the transportation issues, along with the cost that gets involved. But what we've been able to do now is we've been able to take the capacity of power, batteries. We've been able to take a unit where you can actually plug it in the wall and this is one of the big breakthroughs, we have a contained power system in here that you can actually take a treatment using the battery source for up to 45 minutes, which is plenty of time for a treatment. And you can actually do it while you're still mobile. Now, the wonderful thing about that is now a patient, if you were in a car, you were somewhere where you had a flare-up in an airplane, and you needed to use your unit, you could do so, even though you couldn't plug it in. That's not the best way to use it, and I'll explain to you later why, but it is a possibility we now have. Because historically, one of the reasons you would have to go to the clinic is all of their units were basically 25, 30 times bigger than this. They were big clinical units. They would plug them into the wall. And your portability was only as long as your wire was away from the outlet. We've broken that now. Now what you can do is you can actually take the unit. But when you're at home or at work or when you need a treatment, it does work best to go ahead and plug it in and use it with an AC adapter. Now, historically, when we went to that point, if you needed the power from a portable device, you would literally need a wagon loaded with car batteries or some other thing, which you may have 100 pounds worth of batteries just to get the electricity you needed. Reason we like this is once you went to the clinic and you got a treatment, we had a time period, and it's called carryover relief. And what would happen is when you would come out of getting that treatment, you felt better. Your pain was gone. Your pain actually goes away during the treatment. But you would go for days, hours, for some, possibly weeks, before you'd have to come back to the clinic and start again, get a new treatment. That's no longer necessary with the Infrex unit. You can get a treatment anytime you need it in your own house or wherever you can plug it in, and you can take the treatment. And the good thing about it is it's covered by insurance. We actually put into our Infrex unit, it's a combination unit. It's interferential, which is used for chronic pain, as well as Tens, which is used for chronic pain. When you get this, we will also include another Tens unit. I don't want to sound too sales pitchy to you, but the reason we're going to include the Tens unit is because it has width control, and our other video tells you why width control is important. With the Infrex unit, it does not have width control on the Tens side, but the reason for that is we start taking so much power out of the unit. But we do provide a Tens unit that you can use. Nice thing about interferential, take a treatment, carry over relief. You can now get in your own home once you have your own unit. And of course, we always provide the unit as a free trial to see if it helps you. We believe in our product. It will work for you or it will not work for you. But there's no wishy-washy about this. You will get relief or you will not get relief, and you will be the one that makes that decision. While we're at it, let me just tell you why this interferential and electricity is important. Interferential is nothing but sending 8,000 plus pulses per second of electricity into your body versus a Tens unit, which is 150 pulses per second. Why is this important? 8,000, when you're coming from two different angles, you have electricity mixing together, and you get into what we call capacitance and other things that the body does with electricity. But with 8,000 pulses per second, remembering pulse per second is nothing but how many times you turn off and on a unit with the battery source. We do it 8,000 with the Infrex interferential unit. With the Tens, we do it 150 times. This provides you immediate pain relief. This one doesn't. It will modify it, but it's not the same type of relief you get here. But when you turn a Tens unit off many times your pain will come back. So you have to turn the TENS unit back on. With interferential, when you turn the unit off with the Infrex unit, your pain should be gone or greatly modified. But that's the difference between 8,000 and 150 pulses per second. But that's the technological breakthrough, is that we can now do this many pulses per second from a disposable battery source, and we can let you take it home, and you can plug it into the wall and take your treatment when you need it. On electrodes, why are electrodes important? Well, it's real simple. When you had a TENS unit, you had 150 pulses per second. You could actually take a 2x2, which is the standard electrode that's used in TENS. You have 4 square inches of area. You don't have but 150 pulses. So as that comes out, that's not too concentrated. That's still fairly comfortable. If you tried to take 8,000 pulses and you ran it through a 2x2 or standard TENS electrode, it is so much electricity passing through that it gives you a little sticky, prickly sensation. That is not comfortable. And so what happens, it causes pain. So what we do is with the Infrex unit, we include larger electrodes, because this is 8 square inches, a 2x4, so that we can disseminate the 8,000 pulses over a larger area. Or we use a 3-inch round, which is over 9 inches of contact surface area. So those 8,000 pulses are either going through an 8-inch area or a 9-inch area versus 4 inches. That's the reason electrode choice is important with interferential or Infrex unit. And that's why we include the things we do. And we'll be glad to work with you on electrode systems that work best to help you accomplish your goals.